I was born in Owensboro, Kentucky. All of my family are farmers. I enjoyed working on the farm as I grew up. We had cattle, we had hogs, we had sheep, and so you have a focus on what you want to achieve, what you want to get done.
The strong work ethic cultivated in Mark Newman's youth is clearly evident in his adult life. With a passion ignited at Duke under the mentorship of famed anesthesiologist Jerry Reeves, Dr. Newman pioneered pre- and post-operative risk factors that can lead to neurocognitive decline and mood changes following prolonged anesthesia, particularly during cardiac surgery.
And in fact, he had a series of seminal papers that really brought this issue to the forefront in terms of potential loss of cognitive function.
His discoveries regarding the management of body temperature and glucose levels to improve cognitive outcomes are used around the world today.
And we found out that if we rewarmed more slowly to a lower peak temperature, that patients did better. And so the idea was we could continue and change practice across the country, and I think we've seen that.
There's a greater awareness of the types of drugs that are used, of the course and conduct of operation, the duration of operation, and then very close attention in the post-operative period, because folks may have short-term memory deficits that were heretofore unrecognized.
Working with a multidisciplinary team, Dr. Newman also developed a highly successful perioperative genomic assessment that collects information about the genetics and mechanisms behind cognitive loss following surgery.
And I really think that's the future, understanding better so that we can give the best treatment to each individual.
He currently is working on a large-scale study funded by the NIH that is looking at the ability of the drug lidocaine to protect against cognitive dysfunction in certain people.
It looks like in certain patient populations that lidocaine may be neuroprotective against cognitive dysfunction or stroke, and we're in our second trial now, but it has to be very precise in the right, it's like a lot of other things, it has to be very precise in the right patients.
Dr. Newman earned an undergraduate degree in biology from Western Kentucky University and a medical degree from the University of Louisville. Because of his extensive experience with farm animals, he thought early on about veterinary medicine, but
I enjoyed more feedback with my patients than I was getting and thinking about taking care of animals.
Following residency at Wilford Hall U.S. Air Force Medical Center in San Antonio, Texas, he came to Duke in 1988 for a one-year fellowship under Dr. Reeves.
He pushed me just enough and gave me the support that I needed to be able to achieve the things that I probably didn't even see as possible when I started.
He then held joint appointments for 2 years at Wilford Hall and the University of Texas Health Sciences Center and was deployed for Operation Just Cause in Panama and Operations Desert Shield and Desert Storm in the Persian Gulf. He returned to Duke in 1992 as Assistant Professor of Anesthesiology and was named Chief of the Division of Cardiothoracic Anesthesiology in 1994. In 2001, he was named Chair of the Department of Anesthesiology.
What I've been impressed with Mark is he really is able to balance the role of running a department and also being very approachable, and I think probably that's the hallmark of his leadership. It's
an environment where people are happy to come to work every day and they're happy to be in the anesthesia department, and they think that Mark has their ear and that he's a good and strong advocate for their professional needs.
In 2010, the University of Louisville honored Dr. Newman with a Distinguished Alumni Award. For all of the dozens of honors Dr. Newman has received, he is quick to point out that he couldn't have done it alone.
Individual awards in a team game, I think are exciting, but I think it's really, I hope that the team sees that as a win for them that they're a part of.
Dr. Newman has been married to his wife Susan for 31 years.
She's been the support. She also sees more in me than I often see in myself, and she's been, the rock that's been a part of our relationship for 31 years.
They have 3 children. Sarah, a 2007 Duke graduate, Jack, a senior at Trinity University in San Antonio, and Catherine, a Duke freshman. The family loves to travel together, and Dr. Newman enjoys an occasional round of golf. And his biggest hobby outside of medicine is wine collecting.
We really enjoy doing this with friends and colleagues so that we can experience it together. As a last note, I just wanted to say to all the awardees this year, congratulations and cheers.